Hi there. Thanks for joining me on a quick session about smoking cessation therapy. I'm Leanna, I'm a nurse, and I'll be leading this presentation today. So we're going to discuss this case study. Kiko Parker would like to stop smoking. What meds can we offer? And we're going to discuss a couple of them today, actually, and one kind of more in depth. The first medication we'll discuss is varenicline, also known as Chantix. It is the best bet. It's a first-line therapy for smoking cessation. It has the highest success rate of any of the medications that we can offer, which, as you can see, is 30 to 35%. Abstinence at 6 months versus placebo of 10 to 15%. That's a decent rate. It works by blocking the nicotinic receptors in the brain, and it does reduce cravings for nicotine. The nice thing about varenicline is that you can start taking it while you're still smoking. So if you have a goal date, you can start taking the medication 8 to 14 days before your goal date to stop smoking, or start taking the medication and then stop 8 to 14 days after starting medication. The dosing schedule starts with half a milligram daily for the first half of the week, and then goes up to half a milligram twice a day for the second half of the week. And then starting in week 2, you get up to the therapeutic dose of 1 milligram twice daily. The goal is to take for 12 weeks as tolerated. That can actually be continued if there's a high rate of relapse for the patient. As you can see, there is quite a cost difference between insurance and not having insurance. Probably the same for most medications, but without insurance, it's about $100 for the first week, and then $500 a month after that. With insurance, you're looking at $14 for the first week, and then about $1 a day, a little bit less than $1 a day for a month supply. So that's much more reasonable for folks, especially who, might be short on resources. The way this medication works is it is a selective partial agonist of the alpha-4 beta-2 nicotinic acetylcholine receptor. So it partially blocks that receptor, cutting down on nicotine cravings. The only form is an oral pill form. It's absorbed in the GI tract and then excreted through the urine. There's not a whole lot of hepatic involvement, no cytochrome P450 involvement, so it's not affected by the enzymes there. It's excreted almost completely unchanged as well, and the half-life is about 24 hours. Renal function tests are necessary before starting this medication to make sure that patients can excrete it properly. So in terms of side effects, the most common side effect is going to be nausea. Patients who experience nausea can take the medication with food. That does help cut down on some of that. Most of the common and lesser common side effects are GI related. So some vomiting, abdominal pain. A lot of patients also complain about sleep disturbances, whether that's insomnia or vivid dreams, and also some headache. Some more rare side effects would be the neuropsychiatric risks, and then seizures, which seizure risk is increased for patients who have a seizure history already, and then some other neurological things like night blindness or changes in color vision. Some more serious adverse drug reactions to monitor would be, again, those neuropsychiatric reactions, so it can affect a patient's mood. Increased risk for depression, suicidal ideation, agitation, anxiety. If a patient is already struggling with any of these conditions, might not be the right medication for them. They are a higher risk if they have any of those before starting varenicline. In terms of cardiovascular risk, MI, angina, arrhythmias, again, higher risk for those with a pre-existing condition related to the heart. And then, of course, any hypersensitivity reactions like Stevens-Johnson syndrome. So we're going to monitor for rash and any symptoms of an allergic reaction. To monitor effectiveness, we want to ask the patient regularly about their nicotine cravings, make sure that the medication is working for them, no point in continuing a medication for 12 weeks that isn't helping them to reduce cravings. Monitoring kidney function, of course, as we mentioned, because this medication is excreted through the urine. Monitor any changes in mood. Consider changing the medication if the patient does develop any um, anxiety, depression, suicidal ideation. And then monitor sleep quality. The vivid dreams may not be disturbing to everybody. Insomnia may not be the case for everybody. But just checking with the patient and making sure that their sleep isn't affecting sleep quality is not affecting their life quality. And then tolerability of GI side effects. About 30% of patients will have some nausea, so making sure that they can tolerate that. There are a couple of alternatives patients can try if they don't want to try varenicline. Bupropion or Wellbutrin is a pretty well-known antidepressant. It inhibits norepinephrine and dopamine reuptake, and can help reduce withdrawal symptoms and cravings. It does have about 10% less success rate than varenicline at 6 months, but still not bad. It is good for patients with depression because it's also going to help with those symptoms as well. And it can help limit the weight gain after quitting, which is a big complaint for a lot of people quitting smoking. It is more effective when used with nicotine replacement therapy. Varenicline cannot be taken with NRT, so the nice thing about bupropion is that you can use it with the nicotine gum patches, lozenges, and all that. So the dosing schedule will be to start with 150 milligrams daily for the first few days, and then on day 4, switching to BID as long as it's being tolerated. And then bupropion does have a black box warnings for increased suicidality in patients under age 24. So something to consider if you have a patient who is on the younger side. Nicotine replacement therapy can be helpful as well. Again, it can be taken with bupropion. It delivers controlled doses of nicotine without smoking. It does have a 15 to 20% success rate, so that's better than placebo. Multiple options. Patients can put on a patch. They can also substitute with lozenges and gums throughout the day, and they don't just have to choose one. Almost all of these are available over the counter, and some states like Maine have programs where you can get them for free. And a nice thing about nicotine replacement therapy is that it can teach the brain not to associate nicotine with the habit of smoking. So it helps with that behavior change, that habit change. Some final tips and takeaways for varenicline is that it is the most effective and safe medication for smoking cessation, especially those without any pre-existing conditions. A young healthy person probably wouldn't have many side effects with this medication. Definitely take with food to reduce any of the GI side effects, and then do not use it with nicotine replacement therapy. Some things to monitor, and stop the medication if the patient develops mood changes, sleep changes, a rash, or any other allergic reactions, or they have a cardiovascular event. You definitely want to consider something else like stopping the medication and making sure that the patient is well enough to continue. And then you can repeat the treatment if they're at a high risk of relapse. So thanks for listening. Hope you learned something today. And a couple of references for you. Thanks a lot.